Mhairi is 50 years of age and lives at home with her husband. She has a part-time job in the local supermarket. Her 2 children are away now at university. She has breast cancer and has just finished 4 cycles of neoadjuvant chemotherapy to shrink her cancer before surgery. The surgeons are hoping to do a lumpectomy, but there is a possibility that she may need a mastectomy. Normally she appears calm, in control and polite and doesn't really show any emotion. But when she was last in the chemotherapy unit, she was tearful and worried about the forthcoming surgery. She fears having a full mastectomy and the impact this may have on her body image. The chemotherapy nurse has asked the breast cancer nurse to speak to Mhairi in the hope that she might be able to alleviate Mhairi's fears.
Hello?
Hello, is that Mrs. Mhairi Brown?
Yeah.
Hi, Mrs. Brown. This is Karen, the nurse from the hospital. I believe that you're expecting my call. Is that right?
Yeah.
Just before we get into the conversation, can I just check a couple of things with you, please?
Yeah, all right, yeah.
Well, firstly, can I just check I'm saying your name right? Is it Mhairi or Mhairi?
It's Mhairi.
Okay, are you happy for me to call you Mhairi?
Yeah, of course, yeah.
Lovely, thank you. I'm sorry if you've been waiting a long time for me to call you because some of the calls have ran over this afternoon. So I hope I haven't kept you waiting too long, but it is good to speak to you now.
Oh, thank you. You know, I'll come in and I'm really pleased that I've managed to get this call. Haven't long been in, so thanks for calling me.
Okay, lovely. Can I just, one last check, can I check that you've got some privacy there or you've got somebody with you listening if they want to?
No, better off on my own, thank you.
All right, okay, lovely. So, as I understand it, you were in the chemotherapy unit this week and the chemotherapy nurse has called me to say that you were upset about the surgery that's about to happen in the next couple of weeks. And she thought it might be worthwhile if we had a conversation about that.
Yeah.
But so that I can understand things fully from your perspective, do you want to tell me what's been worrying you?
Well, like, I saw the nurse, right, and she, you know, I know I've got to see this surgeon and he's gonna say really that, you know, I'm probably gonna have this lump thing, whatever it is. But then I'm thinking, what if he does decide I've got to have my boob off, like, you know, and I don't know how we're gonna cope with that.
You don't know how you're going to cope?
Sorry. It's, well, you know, I've always looked after myself and everything and, you know, I've, you know, always been nice when we've gone out and all that stuff. And my husband's, he's always said to me, you know, you look really nice and feminine and all that. And now I think I'm thinking, because I'm not going to be like, you know, normal, he's going to go off me, like, you know, and he won't be able to look at me and stuff if I have that off, taken away. Sorry, do you see where I'm coming from?
I think so. It's a worrying time, isn't it? So there's uncertainty about the surgery and you mentioned about having the lump thing or having it taken off. So I suppose we're talking about whether it's a lumpectomy or a mastectomy and I'm hearing that both yourself and your husband really have concerns about how you're going to cope with this moving forward and there's some uncertainty about what exactly is going to happen in terms of the surgery.
Yeah, I think I'm more worried about, I mean, he ain't said much about it. I think I'm worried about what he might think. I think I'm sort of thinking about it quite a lot. He ain't said anything. I'm just worried myself about it and thinking, oh, will he cope with me not having a boob proper and all that stuff? So it's all in my head really, but I just needed to tell somebody.
And when you say cope, can you tell me what you mean by that?
Well, I suppose going through anything I've got to go through, but I think I'm going to struggle with my body if I have a mastectomy, and I think that's, coping with that, that I'm going to be ugly.
Thank you. Thank you, Mhairi, for sharing that with me, because I guess that can be difficult to admit and to talk about. And I suppose we can't cover all of that in our conversation today, but what I would like to do is try and offer you some reassurance that regardless of what happens moving forward, that we'll be here to support you every step of the way through this.
Thank you. That's really kind. Thank you. Well, I felt quite a bit better for talking to someone, and I felt quite reassured. Not because, I was told about what surgery I was going to have or whatever. There weren't any sort of real answers there about the surgery, but I think I felt reassured because I had someone that got my back and they were supporting me. Well, she had a lot of patience. She waited for me to sort of say what I wanted to say, because I was going on about my body image and everything. I didn't feel that she had any personal opinion of me, and I felt she was encouraging me all the way along and being very kind with it. So, yeah.